Thanks to you both for your time. Thanks for joining us today. And Evan, I'd like to start with you. Let's just chat a little bit more about HCA Houston Healthcare. Your network really is extensive.
Sure. So HCA Houston Healthcare, we're part of HCA's Gulf Coast Division, and our team of outstanding physicians and accomplished nurses treat over 1 million patients a year here in the Houston market. The Houston network that we have consists of 13 hospitals, 11 freestanding emergency departments, 10 ambulatory surgery centers, 16 urgent care centers, and numerous diagnostic facilities across the city. You probably recognize our Texas Women's Hospital of Texas, our Texas Orthopedic Hospital, and we also have longstanding relationships with community hospitals and communities such as Clear Lake, Pearland, Tomball, and North Cyprus. And just recently, we launched the HCA Houston Healthcare brand, which is a unified brand that recognizes the entire network and not only shows the strength of our caregivers here in Houston, but also recognizes the broader national footprint and strength of HCA Healthcare.
Well, and it's also a great peace of mind for the community knowing that when needed, they have so many different places to go and to visit you guys. Kelly, I want to bring you into the conversation. Let's talk about your providers. And obviously our healthcare heroes, they are on the front lines every single day. Let's talk about some of the steps you've taken to ensure their safety and protection.
Absolutely, Derek. Thank you so much. And back even in March, we started many things to make sure that our colleagues, our physicians, our visitors, and our patients were safe. And so we started with limiting our visitation back in March, and then we started a universal masking policy that we began really at the end of March, and then really increased the vigilance around that and the requirements around universal masking at the 1st of April. So everything that we do, we are really using scientifically based evidence to make the right decisions for our colleagues and our patients.
And you're also doing practical things like giving them hotel stays, doing the laundry to ensure that these are just some of the basics that are covered. They don't have to worry about them.
Absolutely, Derek. For those colleagues and members of our team that are caring for patients that have COVID-19 or even that are suspicious for having COVID-19, we have scrubs that are available for them so that they can change into those scrubs when they come to work and then change back into their regular clothes before they go home so that they're not carrying any of the virus home with them. And then also, in addition to the scrub program, we have a hotel stay program where any individual that is caring directly for a COVID-19 or a suspicious COVID-19 patient, that they can stay in a hotel while they're working, and then up to 5 days after they end that time, so that they can ensure that they're keeping their family safe as well.
Wow. And can you imagine, I mean, it just occurred to me that after a long day, what if someone works a huge shift, like 12 or 15 hours, and then they have to go home and do their own laundry to sanitize their scrubs? So it's great that you guys are just taking that out of the equation. Evan, we want to jump back to you. Let's talk about what you guys are doing in terms of like a paycheck protection program and a physician rate abatement for affiliated physicians, because this is also a topic of conversation right now. So many small businesses, we've heard about the difficulty people have had trying to get loans to stay afloat, but you guys are actually taking your own steps to ensure that people have that added safety net.
Yeah, thank you, Derek. As you know, physician relationships and our aligned and affiliated physicians are so important to the organization and the business of healthcare and the care that we provide. As you mentioned, we've launched both an education and assistance program to help for the paycheck protection program that the SBA has launched, and we want to make it as easy as possible to support those physicians and support their office workers and staff members. In addition, you mentioned our rent abatement program. As you would imagine, we have medical office buildings on many of our campuses, and we think it's important to allow physicians a time of relief. And our rent abatement program allows physicians 2 months of rent-free activity within the space. And the only requirement is that they would extend their lease by 2 months at the end of the term. We believe that will help them navigate this COVID environment.
And Evan, tell us about this ventilator distribution program you guys have.
Sure. So earlier in April, you probably saw Sam Hazen, HCA Healthcare's CEO, spend time in Washington with President Trump and other healthcare leaders across the country. And that was to come together with a public and private partnership to identify ways that we can work together to tackle this virus. And the ventilator program is one where HCA across the country will support other hospitals who are in need by donating 1,000 ventilators to other community hospitals across the country to help them take care of COVID patients.
Telehealth is also being talked about a lot these days. I know you have a very extensive network, but telehealth is something that HCA Houston Healthcare is really putting at the forefront so that they can have that interaction with a provider without actually physically going into an office somewhere.
Yeah, absolutely. And telehealth is very important, of course, and growing in its importance amongst the times that we're in. I mentioned our urgent care network, Care Now. We've launched virtual visits and telehealth visits where you can spend time with a physician, nurse practitioner, or physician's assistant and have one-on-one health assessments and get your healthcare needs addressed from that perspective in an urgent care setting via an online visit. We've also have different programs where we're able to assess both our healthcare workers as well as the community and understand if they are presenting not only with COVID symptoms, but other symptoms that they need to have further follow-up and checks around. And then also within our inpatient setting, our emergency room setting, and our employed physician practices, we've launched telehealth platforms to allow patients to speak virtually with their caregivers. So certainly a growing part of our ability to care for the broader Houston community.
And we're tight on time, but very quickly, what's the status of elective care or elective surgeries? I know a lot of folks are asking about that.
Yeah, absolutely. Great question. Here at HCA Houston Healthcare, we are following not only the governor's recommendations, but the Texas Hospital Association and the Texas Medical Board recommendations, and focusing on the safety of our patients as we always do, and making sure that we have an environment to take care of the elective surgical needs as well as the emergent surgical needs that our patients face during this COVID time. We will be getting back into the business of elective scheduled surgery on Monday, and as you would imagine, spending a lot of time with our physician community as well as broader caregivers to make sure that we do that in the safest manner possible.
Well, Evan Ray and Kelly Nations, thanks to you both. Thanks for your time. It's great to see you both. Hopefully we'll see you right here in our studio one day very soon.
Very good.
Thank you.
And in the meantime, if you would like more information, you can visit HCAHoustonHealthcare.com. Coming up next on Houston Life.